Well, the beginning of our efforts at patient-centered care really started with Dr. Fred Bobet, who was president of the college 2 years ago, and he really felt that we had kind of missed a step in our organization and in not focusing on the patient. And so his year of presidency was named the Year of the Patient. And from that came the committee that I chair, which is the Patient-Centered Care Committee. And really what the effort is all about is to think about our cardiovascular practice in a very different way, in looking at the patient and what the patient's needs are, rather than just one-size-fits-all models. So some of the things that the ACC is doing regarding patient-centered care have to do with community engagement, going out into the community as practitioners and engaging with our patients in a different way. We have done some work on the patient-centered medical home. We're very interested in forwarding the area of health literacy for patients. And a big area is that of shared decision making, which is a process that we bring the patient, instead of just telling the patients what they need, we really want to involve them in that decision. For example, for a procedure that they might need, a medication or not, a device that they might need or decide not to have, to really bring them into that process rather than being sort of the old patriarchal or matriarchal model of the physician tells the patient what to do. Well, some of the things that I've already mentioned, I think, will help improve the patient-physician relationship, but I think that what's happening now with more engaged patients, people are going on the internet and sometimes people will actually download things from the internet, bring it in and talk to the doctor about it. And I think what we're trying to help on the physician and nurse side is to provide that education to the patient ourselves on our own portal, which is called cardiosmart.org, so that a patient can go and get information in advance of the office visit and become better educated. And we think that that's going to solidify that relationship between the patient or nurse and the patient, and also take the burden away from the clinician in the exam room, where everything really has to happen in a 15-minute visit. We know that that's not realistic, and so we think that providing education in an online format and in other ways is really going to enhance that relationship.